I'm Michele Hemmings, and we're going to be launching our school resources today. I begin today by offering acknowledgement and thanks to our community, and a thank you for those who gave up their time to evaluate the school resources material. January the 24th is International Day of Education, so it's a great time to launch our school resources. Our objectives for this presentation today was to highlight the change to our resources that we have recently implemented. This process started after receiving community feedback that the resources needed a revamp. Also, to demonstrate how the new resources can be utilised by educators and families so as to enable the child to be in an environment to learn to the best of their ability. Also, to educate schools and educators in ways that will empower them to make a difference at school for the child with Mito. I will spend some time going over the school resources to help the community get the most out of the resources, and then I will highlight some information from the resources that is relevant heading back into the school year. So we did previously have some information available, but it wasn't as complete as it could be. Children with mitochondrial disease, Mito for short, may have different or additional needs when they are at school. Parents had previously identified that they wanted more information and that new resources could help them inform their kids' educators about Mito. We use the term educator because it's not just the teacher that may be working with a child. It could be teachers' aides, school staff, after-school carers who help the child with their education. Your child may be the very first child with Mito that the educator has come across. So we wanted to create some resources that would complement our existing ones. The Mito Foundation resources can help parents, carers and teachers support a child throughout their school journey. The resources were developed in collaboration with our Mito parent school community, school educators, along with some health professionals. The resources available include information sheets, templates and activities to help a child's school journey. The school resources can now be found on the School Education and Support page, which can be found under the Managing Mito tab on our website. The resources are divided into two areas. The first is aimed at parents and carers and covers such topics as consideration for when your child is starting school, preparing for school, an About Me page that can be used as a way to introduce your child and their individual needs to their educators. Also, there is information on advocating for your child at school and, very importantly, managing Mito at school. The second resource group is aimed to assist educators to understand Mito and managing Mito at school. There is a school education pack called Mito for Kids, which includes the little book about Mito and a classroom education resources that include age-appropriate activities to teach children about Mito. It is great for teaching fellow students in the classroom a little bit about what the child with Mito may experience. Under parents and carers, there is information available that can inform teachers and educators on how to help a child with Mito manage at their school. When should I use these new resources? These school resources were designed not just to help parents of a child who might be attending school for the first time, but for children who are entering into a new school year in 2024, maybe changing schools or moving into high school, and also can be a guide to use at the preschool level. The resources can also help when a child whose Mito is now impacting their learning capabilities, and for a child who has been recently diagnosed with Mito. When parents are preparing to send a child to school for the first time, the months leading up to sending a child to school is a great time to make sure your child's future school can meet their needs and to set expectations. At the start of the school year, this is a great time to think about what has worked in the last year and what didn't. Many children will be in a new classroom with new classmates, where education or providing new information may be very beneficial. When a child is starting at a new school, there will be new educators, new classmates, and new school supports. When there is a new teacher, they may not be familiar with Mito, and they may need to be educated in Mito. A child who has recently been diagnosed may require education, communication, and regular reviews between the school and the parents. A child whose Mito is starting to impact their learning may require some extra information on how to help your child. So this can be accessed in our new resources. Whilst we were undertaking this project, I had a mother say this quote to me, and I thought this quote was worth documenting. All it takes is a little time to understand how Mito can affect a child's ability to learn. It is not hard to understand Mito. With this understanding, we would see effective, simple changes being made in the school environment, and our children would feel safe, included, and understood. There is a lot to consider starting a new school year when you have a child with Mito. This process often starts with preparation before the end of the previous school year. Communication is the key to successful transition with each school year. Communication with the school involves identification of a key person at the school that will liaise with you or your representative. Identifying the preferred method of contact with the school so regular meetings can be scheduled. Encourage regular contact with classroom teachers so to identify and resolve issues early. Find out about any school services that can help and contact them. This might be a guidance counsellor, for example, a school nurse or a chaplain, peer support, or some schools have buddy systems, which could be of help to you. Set goals in your individual education plan. Regularly discuss these with your child's teacher. Communication with your health teams is also important. This may include liaising with the involved allied health team. This may involve the review of future allied health involvement with the child. Times and frequency of participation may need to be changed. For example, physiotherapy and occupational therapy appointments may need to be attended during school times. Set goals in your individual education plan. Regularly discuss these with your child's teacher. Sometimes connecting with the chronic health coordinator can assist with ongoing education of the child and the family at the school. These child chronic health coordinators can be found in most children's hospital networks. When it comes to children with Mito, there are 4 areas to consider for the management of Mito at school. There may be other factors, but these are the 4 we hear about the most, and the ones families often have the most questions about. That's energy, temperature control, nutrition, PE, and school involvement. Starting with energy. Energy can be a big issue for children with Mito. Mito disrupts cellular energy production and metabolic processes, which can cause fatigue. So for children, be prepared for the possibility of increased overall fatigue as the school day gets on, and learning can take an enormous amount of energy. And remember, it's not a passive activity. If the child has fatigue, it can be hard to continue to focus on what's going on in the classroom. So the child may not be able to give their attention to learning. Recognising signs of increased fatigue can help with the child managing their school day. Some examples that can demonstrate that fatigue is affecting the child are, for example, muscle weakness, like being able to hold a pencil may become more difficult. The decreased ability to talk and think, see and hear, a change of behaviour and mental health, and the ability to sit and stand. Nausea and headaches, increased body pain and cramping may also be exhibited. Some simple management strategies to help with conserving energy is where the child is positioned in the class and being able to change positions when required. Extra equipment can help, especially later on in the day, IT equipment, bean bags, and access to a wheelchair. Having a place that allows peace and rest when fatigued is also a good idea. For example, having an area in a sick bay at the school. Some of the issues children may face at mealtimes are swallowing issues, drooling, poor digestion of food, and eating can take time, inability to hold utensils. Some recommendations are inactivity and rest during mealtimes so food can be digested. Good positioning is important and may need to lean against a support or be encouraged to sit upright in a chair. Regular eating of nutritious snacks also is important. They may require supervision due to swallowing issues and some assistance with utensils or support to hold food. They may require rest when eating. This time may need to be extended as eating can sometimes take a long period of time. Some older children may wish to have privacy and peace when eating, as drooling may occur, especially at lunchtime due to fatigue levels. Optimally, consistent room temperature is ideal for a child with Mito, so energy can go into digestion and not trying to stabilise the child's temperature. Children with Mito can be sensitive to heat and cold. Extreme temperature is known to cause acute worsening of symptoms. It is recommended that a consistent environmental temperature is ideal for a child with Mito. Schools can help manage challenges with temperature variations by placing the child in a classroom with controlled temperatures. Having a plan that includes a way to combat temperature sensitivities, for example, wearing hats, clothing, and also limiting sun exposure can make a significant difference. Although most primary school age children are keen to keep up with their peers and attend after school activities such as sports, it's important to consider the effect that this will have on their health and energy levels. Extra support may be needed on those days to help manage your child's energy expenditure. It may be extra snacks, extra rest time, pre and post the activity. Teachers can help children participate in activities and events or to be involved as a volunteer. Teachers are encouraged to plan with the family around school events. And understanding that fatigue levels can change day to day will help with planning the school day. Fatigue may present as differences in participation levels and changes in behaviour during an activity. Having a plan for excursions, PE classes and school events, for example, cross-country, can help prevent fatigue complications. Children can still attend when a plan is in place, as inclusion is imperative. If you have a school-age child and you would like to share information about Mito with both educators and peers, we have the Mito for Kids pack. It contains age-appropriate activities, our PowerPoint, and a little book about Mito as pictured here, which is a picture book that explains what Mito is and how it affects people in a way children can understand. If you'd like a copy, we have a form on our website under both the For Parents and Carers pages and the Educators page. Or if you'd like, you can contact the helpline on 1300 977 180 and have the booklet sent out to you for your own household or for a school or even for a school's classroom library. In summary, having an ongoing partnership with the school can eventually lead to your school gaining confidence in advocating for themselves. This will lead to a better schooling experience for the child, but also set them up to be an advocate for themselves in the future beyond school. The Mito Foundation has a number of resources on our website to help the family, students and educators learn more about Mito and how they can help make school life easier for the child who has Mito.